I am Dr. K Lakshmi, Laparoscopic and Bariatric Surgeon at Global Hospitals, Hyderabad. If we see the percentage of obesity in India, we have it is roughly around 3 to 5% across the country, whereas some well developed states like Delhi or Punjab, you may see a higher percentage, maybe around 20-25% of the people will be overweight to obese. But still the numbers when compared to our population, 3% of this huge big population is a big number compared to US, where they have almost a 25-30% morbid obesity actually. But because we have big numbers of population, even the small 3 to 5% reflects as a big number of obese people. Obesity inversely affects the productivity of the person. So, we as a country which is still fighting economic issues, if we have most of the people, that is the young and the middle aged, who are getting affected with obesity, and they are the ones who are the most productive for the country, we will be losing out more economically if these numbers still continue to persist or grow. Children have a more higher percentage of obesity, 10 to 15%, because one is the Indian mentality that a child should look big and chubby. So, they are force fed, and then now there is lot of junk food which is available, and to appease the children, with working parents not able to spend more time with the children, to just appease them, they offer them all these high calorie foods, and there is less of exercise. At school, almost no existent playgrounds, and when they come home, it is not safe to allow your child to go outside and play. So, ultimately they end up sitting at home, and what they so called play is just on the computer or the video games. So, there is almost nil exercise and long study hours plus lot of junk food, which is causing an increase in the childhood obesity. When we say morbid obesity, means someone whose body mass index or BMI is above 30. So, beyond 30 BMI points, it is very difficult to only with diet and exercise to come down to a BMI of around less than 25. You have to be ideally between 18 and 25. So, it is difficult for majority of the people. Maybe few can achieve it with proper diet and exercise. Even if they achieve weight loss with diet and exercise, the maintenance is the most difficult part. So, ultimately when obesity becomes a major disease, then you need to have strong and positive weight loss methods where bariatric surgery has stood the test of time. Apart from weight loss, bariatric surgery causes lot of improvement in what we call the metabolic syndrome. The type 2 diabetes improves by 70 to 80%, their hypertension almost comes down by 70%, cholesterol levels normalize. People who are suffering from severe respiratory restriction, what we call obstructive sleep apnea, they almost improve their sleep apnea, their respiration becomes normal. There are people who become dependent, they have to carry a CPAP machine wherever they go. So, they come off the CPAP machines, and the joint pains improve. And for females, obesity is linked with infertility. So, once they lose weight, their fertility improves. So, it is not only weight loss, but a significant improvement in the other comorbid conditions which follow obesity. People think that in what bariatric surgery is, that you do not allow the food to stay in the intestines, and you just connect the food pipe to the lowermost part of the intestine. So, whatever you eat, you pass off in the stool. That is wrong. The person can eat and eat what is sufficient for their ideal body weight, and in some types of bariatric procedures we have what we call the bypasses, but we bypass only 1.5 to 2 meters of small intestine, and we have 6 meters of small intestine. So, we can live with 1 meter of small intestine. So, here the person post surgery almost has 4 meters of small intestine. So, the digestion and absorption will happen with a little restriction in the calorie absorption, and we need them to take vitamin and mineral supplements. So, that is not anything negative. because but there is also a fear of death, because then some stray incidents happen when you are doing a very obese patient or a very elderly patient who is obese and has become sick because his heart, lung, kidneys have got damaged in course of time due to weight. Whenever you take these people, not only for bariatric surgery, for any surgery, there is a chance, maybe 1 to 2% chance that you can have a fatality. But these are projected as bariatric surgery is equal to death. So, because of that fear, lot of people are still avoiding undergoing this procedure and eventually succumb to their weight. Their weight becomes so much, damages their heart and lungs, and they ultimately succumb to the weight because of these myths. So, these myths should go. It is a very safe surgery. It has been proven that the risk is equal to doing a gallbladder, appendix or hernia in a same weight patient. So, it is like any other surgery, and people should use it to reduce their weight. For young ladies, as I said before, that infertility goes hand in hand with obesity, because there is lot of negative hormonal imbalance which happens once the person is obese. The fat itself acts as an endocrine hormone, secreting lot of hormones which cause insulin resistance and suppress ovulation. So, when the people start losing weight, they start, some 50 to 60% of them spontaneously recover their fertility, start conceiving, and especially when we are doing young ladies, we have seen that they can safely go through their pregnancies and with the proper monitoring have almost normal babies, but they need to wait at least for 1.5 to 2 years before they plan to start a family. Now there are hospitals and hospitals everywhere, but these are special set of patients purely because of their huge weight, and whenever we anesthetize them, then their heart and lungs can give us trouble. So, ideal bariatric centers should be, first should have equipment to handle a very heavy person, right from the wheelchair to the bed to huge big doors to big chairs in the waiting room to a big OT table, and then your team, mainly the anesthesia team should be capable of anesthetizing a very heavy person, because if they are not capable, they will not be able to get the airway tube right in proper place, and then that can end up with problems. And in the post-op period, because these people have been obese and their heart and lungs have been affected some way or the other by this obesity, they can trouble us. So, it needs a very experienced anesthesia team and a good skilled surgeon. That is very important, because the surgeries should be done very quickly rather than taking long hours to do the surgery and exposing the patient to long hours of anesthesia. And in the post-op period, they should have a good nutrition team, a good physiotherapist and good nursing care to take care of the post-op period. If all these are in place, then the problems associated because of the weight usually come down significantly. Bariatric surgery has improved over years. The number of procedures which are available, the safety, the instrumentation and lot of instruments to offer safety to the patients have improved. And also now we have good anesthesia techniques and good anesthetic drugs also. So, the patient immediately recovers once the surgery is done. And patient awareness has also improved. Now people have slowly understood the benefits of undergoing surgery for improving their weight and also improving their metabolic syndrome. So, gradually more and more number of people are coming forward to get their surgeries done in spite of the fears, but that number is still small, maybe less than 1% of this huge population is actually coming for surgeries. And we also need insurance to come into place, because finances is also a big deal. So, this is a bit costly surgery, maybe minimum costing to around 3 to 5 lakhs. So, if the insurance companies come forward and offer bariatric insurance claims for bariatric surgery, then more and more people will surely benefit from these procedures.